topics and opinions expressed in the following show are solely those of the hosts and their guests and not those of W4CY Radio, its employees, or affiliates. We make no recommendations or endorsements for radio show programs, services, or products mentioned on air or on our web. No liability, explicit or implied, shall be extended to W4CY Radio, its employees, or affiliates. Any questions or comments should be directed to those show hosts. Thank you for choosing W4CY Radio.
Welcome to the Ask the Expert show on W4CY Radio and Talk4 TV, where we bring you educational information from top local experts in the fields of legal, health, financial, and home improvement. Now sit back and listen to experts in family law, association law, hearing loss, business brokers, home care, along with many other topics. Now here are your hosts, Steve-O and Sophia.
Hey, good afternoon, Nashville. Welcome to another Ask the Expert show where we bring you the top experts in the field of legal, health, financial, and home improvement. I get so many emails, people going, we make suggestions to bring experts on, and I don't know if you even read the emails. Well, we do. I read every single email, and there is a topic under eye surgery, Lasik surgery, that you all have blasted us about wanting more information. We found the top clinic in the Nashville area, Wang Vision Institute. Let me welcome you to the guy with the radio voice, Dr. Kyle Jones. Hi, Dr. Jones.
Hi there. Thank you for having me.
I tell you what, I am so excited about this show because 12 years ago, somebody convinced me to do LASIK. And the day I walked out, Dr. Jones, what I saw was so different than what I was used to seeing. It was like magic.
Yeah, that is the great thing about LASIK. The recovery is super quick. A lot of patients notice a difference, immediately, especially if it's a high prescription. But yeah, usually when we see patients the next day after surgery, they're seeing almost 20/20 vision, if not 20/20 vision.
And there's no pain at all either. You would think something like this, dealing with the eye, that it would be so painful.
No, the surgery itself is not painful at all. Of course, numbing drops are placed on the eye, and so that certainly helps quite a bit. I tell most patients, the day of surgery, afterwards, after the numbing drops wear off, very, very minor discomfort, kind of like a dry eye sensation, a little bit of burning or tearing. That's normal for the first few hours as the flat peels. But after that, you really shouldn't feel much of anything at all. And there can be a little bit of dry eye symptoms the first few days to a week after surgery. You take artificial tears, of course, to help with that. But yeah, it's really almost no discomfort at all during the surgery, for sure.
You're right. Hey, so Dr. Jones, tell us first of all about Wang Vision Institute.
Wang Vision Institute is a practice located here in downtown Nashville that specializes in vision correction surgery. We help people get out of glasses and contact lenses. We help people see better just in general. There's 5 doctors here in the practice. There's myself, my colleague, Dr. Adi Gaduru. We're both ophthalmologists who do most of the surgery for the practice. There's Dr. Ming Wang, who founded the practice. And then we have 2 optometrists as well, Dr. David Zimmerman and Jake Wishedlowski. And like I said, we specialize in vision correction surgery, mostly LASIK. We do, of course, the most common refractive surgery worldwide. We also do SMILE. We were the first in the state of Tennessee to perform that procedure. We do other vision correction procedures that maybe you haven't heard of, like implantable contact lens, refractive lens exchange. And of course, we do laser cataract surgery as well.
Well, I got to tell you, when we start promoting your show 2 days ago, we got a lot of people wanting to know, does your clinic also do cataracts?
Yes, we do cataract surgery as well. That's correct.
Okay, so we know you do also. So tell people, what is LASIK?
Yeah, so LASIK is a procedure that involves laser, and it's used to correct glasses prescriptions. So basically the way it works, in the old days when LASIK was first approved by the FDA, we used actually a blade, something called a microkeratome, to make a flap in the cornea, which you peel back, and a separate laser called an excimer laser will actually fine tune the curvature, the shape of the cornea, which is that front surface of the eye, in order to correct the patient's particular glasses prescription. LASIK has come a long way since, and it's a much safer, much more precise procedure now. And now we actually use two different lasers. One laser makes the flap in the cornea, and then an excimer laser, again, sculpts the cornea in a particular fashion to correct glasses prescriptions. Place the flap back after the laser does its correction, and that flap usually heals within 24 to 48 hours.
It's a pretty quick procedure, isn't it?
It is quick, yeah. I mean, normally I tell most patients, the surgery itself will probably take no more than 20 to 30 minutes.
Right.
The laser itself to make the flap is about 20 seconds. The laser treatment to correct the prescription is, usually less than 30 seconds, almost always less than a minute. So the surgery time itself is very quick. Mostly the length of the procedure is in the prep and getting everything ready for surgery. So yes, the surgery is very, very quick. The lasers are very precise, and it's a quick procedure. Absolutely. Same day surgery. You come in, have the surgery, go home the same day. And
I went to work the next day.
Exactly. Yeah. Most patients can basically resume most normal activities the following day after LASIK. I tell most patients, go home and take it easy. Day of surgery, the eyes will be minorly uncomfortable. The vision will look a little foggy, as normal swelling that happens right after the surgery. But normally after about 6 to 8 hours after surgery, the vision is starting to recover, and it gets better each hour after that for about 24 hours. And usually when I see patients the next day, they are seeing pretty clearly. They're amazed, really, quite frankly. And they can drive usually. They can go to work. They can resume most normal activities.
Dr. Jones, I had everybody's had their eyes dilated. And, if you don't have those certain glasses on, everything's really fuzzy to you. That's what I thought it was going to be like. But I went to the car. They did recommend someone drive for me afterwards. But I was like shocked how clear everything was.
Yeah, that's the beauty of LASIK. When laser vision correction first came around, there was an older procedure called PRK, which is a great surgery, works exceptionally well, but the recovery time in terms of the vision was a lot longer. With LASIK, we learned that by creating a flap, very thin flap in the cornea with either a blade or laser, you can lift that and use an excimer laser to correct the prescription. When you place that flap back, the cornea heals perfectly. I mean, the healing is extremely rapid, and the vision is basically recovered, like I said, within 24 hours.
I remember that they told me that I had to be a candidate for LASIK, which was a little letdown at first because I went, wow, I'm all excited about this. What if I'm not a candidate? Who's a good candidate for LASIK?
Yeah, that's a great question. So, bottom line is potentially anyone who wears glasses or contacts could be a LASIK candidate. We do testing in our clinic that looks at the cornea, which is the site of the surgery, to determine if you're a candidate based on the corneal thickness and shape and whatnot. There is an age requirement. You do have to be at least 18 years of age or older to have LASIK. There really isn't a maximum age, but we do LASIK on people in their 40s and sometimes 50s as well, depending on the prescription and the goal we're trying to achieve with the surgery. But you have to be at least 18 years of age or older. You have to have stable vision. So your vision, your glasses prescription or contact lens prescription can't be changing every year. It needs to have been stable at least for a good year or two, because that's what we plug into the laser to correct your vision is your glasses prescription. If that's changing frequently, it doesn't make sense to do surgery. We can treat nearsightedness, farsightedness, and astigmatism with LASIK. You have to have like I said, we do testing in our clinic to make sure your eye is otherwise healthy. We can't do it if you have a condition called keratoconus or you have really severe dry eyes before surgery. You're not a good candidate. And then your overall general health should be good. People who, for example, have autoimmune diseases may not necessarily be a good candidate depending on the illness in question. And then finally, and probably most importantly of all, in terms of who's a good candidate, is to have reasonable, realistic expectations from the goal of the surgery. The goal of LASIK is not to give you perfect vision, although, as I mentioned, vast majority of patients do end up seeing 20/20 after the procedure. The goal is to get you seeing clearly enough where you can function well on a daily basis without your glasses or contact lenses. And oftentimes you may see 20/20, but the vision may not be perfect compared to maybe what you were used to with glasses or contacts before surgery. The goal is that you're no longer dependent on them. That's what I tell patients.
Yeah, it was so nice not having to put on my reading glasses anymore.
Sure.
Now you said you talked about astigmatism. Can you still have LASIK if you have that?
You can. So this is a very common misconception that a lot of patients relay to me. All astigmatism is where the cornea, that front surface of the eye, is not perfectly spherical shaped like a basketball. It's got a steep axis to it, so it's shaped almost more like a football. LASIK, what it does is it just modifies the shape to make it more regular to correct your glasses prescription. So LASIK is actually a phenomenal treatment for astigmatism. It works exceptionally well. LASIK, laser vision correction, is going to give far better vision in terms of astigmatism correction than glasses will, because glasses, the astigmatism correction, you have to be looking straight ahead through a glass lens to get the full correction. If you're looking through your peripheral vision, that's distorted. You have to be looking dead on through lenses to get that correction. And contact lenses have their downsides, of course, as well. So, yeah, LASIK works very well for astigmatism.
Well, we're getting a ton of text in. The first one is from Nashville. Mary, does insurance cover this?
So, unfortunately, typically, no. Usually, insurance does not cover this particular procedure. And that's because insurance companies would rather, pay for glasses or contact
Yeah.
lenses. If you do have certain vision insurances, that vision insurance that cover glasses or contact lenses, sometimes may pay a portion of a particular laser vision correction procedure, but it's not typically the full thing. Usually, from a medical insurance company standpoint, this is almost considered a cosmetic surgery, but I would argue it's a functional surgery. It really improves people's
I
quality.
agree. I agree. Jack in Nashville wants to know, uh, can you just have LASIK in one eye, or do you have to have both eyes done?
No, you can just have LASIK in one eye. I mean, more often than not, we do both eyes because usually both eyes have similar glasses prescriptions, and we're trying to improve the vision as much as possible. But no, there are cases sometimes where a patient maybe wants to maintain, they're maybe in their 40s, for example, they want to maintain their near vision and not need reading glasses, and maybe they're a little nearsighted in both eyes, and they can just have LASIK on one eye to correct the distance vision and leave the other eye nearsighted, and then they'll be able to maintain a good range of vision without needing reading glasses, hopefully.
What about, I know people are driving in their cars right now going, okay, this all sounds wonderful, but what about risk and side effects?
Yeah, absolutely. So, overall, LASIK is a very safe procedure. It's been performed over the last 25 years over 40 million times. So, this procedure has a very long track record of success in terms of outcomes and patient satisfaction, which is well over 95%. But there are
Wow.
risks. It's surgery. It's surgery. So I tell patients there are risks with any surgery, as small as they may be. It is our job to inform patients of the risks of surgery. And I would say overall, probably the biggest potential risk of surgery, of LASIK surgery, is what I kind of already mentioned: is that the vision may not be perfect afterwards. We are trying to achieve 20/20 vision and as good a vision as we possibly can. But there's less than 5% of cases where maybe there may be some residual prescription, especially if we're treating very high degrees of astigmatism or very large prescriptions. There may be something residual left over, and most patients are still going to be better than 20/40 vision, for example, legal to drive without glasses, but maybe it's not that perfect, crisp 20/20 vision they were used to before surgery. Again, that though is very rare. That's less than 5% of cases, probably more like 2 to 3% of cases.
Wow.
So that's probably the biggest overall risk of surgery, is that the vision may not be perfect. Now, there are other risks as well, which are exceedingly uncommon. A fraction of a percent. These would be things like infection, epithelial ingrowth, inflammation, irregular astigmatism, risks that may cause you to have worse vision than you had prior to surgery are extremely rare. We're talking one in many,
Yes.
many thousands of cases. So it's a very safe procedure. Side effects of the procedure that we do see in a certain subset of patients are going to be dry eye symptoms. LASIK does cause temporary dry eye symptoms, kind of like a very mild gritty sensation, some burning, tearing, especially that first week as the flap is healing. Very common to see that. It's usually treatable very satisfactorily with artificial tears, over-the-counter lubricating drops. And normally, dry eye symptoms will return to kind of what their baseline was prior to surgery by about 3 months afterwards. So that's usually temporary. Some patients in the first couple weeks after surgery, particularly if it's a high prescription we're treating, may notice some glare or halos around lights, especially at night driving. That is usually temporary as well. That's a normal effect of treatment. And as everything heals and your brain kind of adjusts to the new optics of your eye, that symptom usually diminishes quite significantly as well.
Hey, Dr. Jones, they originally had told me that it would be good for about 10 years. Now, I look back at my calendar, it's been 15 years since I've had LASIK. Now, are my eyes as good as they used to be? No, but they're still pretty darn good, though.
Right. Yeah. So that's a great question. That's something that patients ask me all the time is, I'm going to pay the money for this procedure. How long will it last me? Well, the reality is with LASIK, it induces a permanent change in the cornea. So the results of LASIK can potentially last many years. I mean, 10 years, 20 years. It is not infrequent at all that I see patients who had LASIK in the late 90s, and then
Wow.
the correction is still holding strong. So the results of the procedure can last many, many, many years. Now, the issue in terms of I'm getting older and my vision starts to change, that is more often than not due to the effects necessarily of the LASIK procedure itself wearing off. It's due to other age-related changes of the eye. For example, the natural crystalline lens of the eye ages as you get older. As you get into your mid to late 40s and beyond, your natural lens, which is located behind your pupil, starts to lose its flexibility and loses its ability to focus on things up close. That sometimes changes the prescription of the eye. Of course, you need reading glasses as you get older. So that's one change. And then as you get into your 50s and beyond, actually the lens of your eye starts to yellow and age, and that is early cataract development. And so that is another reason why your vision may change as you get older. That's totally not related to the LASIK procedure at all. That's a natural aging process of the eye.
We have a text from Ruby. This is a lot of text for the first show. She wants to know, what if you're a diabetic? Can you still have LASIK?
That's a great question. So the risk of LASIK, as I mentioned previously, is dry eye syndrome. And it's very rare that we see persistent dry eye symptoms after surgery. However, with diabetes, there's a little bit of a higher risk of dry eye symptoms with LASIK. As long as your diabetes is under good control, meaning your hemoglobin A1C has been chronically under good control at an acceptable level, LASIK could potentially be an option for you. There are other procedures we offer that I won't necessarily get into today, such as SMILE, which is small incision LASIK that results in quite significantly less dry eye afterwards. So that may be a better procedure for you if you have diabetes. And then there's other lens-based surgeries as well. So we certainly can have a vision correction option for you if LASIK is not the answer. There are options, but it basically depends on how well the diabetes is controlled.
We have Jack wants to know, I missed the first part of the show. Can you tell me again about restrictions and what recovery is like?
Yeah, so the recovery with LASIK is pretty fast. As I mentioned, the vision's blurry day of surgery. By the next day, it's cleared up quite a bit. And normally I tell patients, give it about 5 to 7 days for the vision to kind of all the fogginess to resolve and get up to 100% of what you can expect. But expect the next day after surgery, you should be able to basically resume most normal activities. You should be able to drive within a day or two. You should be able to pretty much go back to work within a day or two. um, there's not many restrictions in that regard. The biggest things are going to be no rubbing the eyes the first week, not letting water, such as water from hot tubs, the shower, pools, ocean water, get in the eyes for the first 2 weeks after surgery. And then in terms of physical activity, you can do very mild exercise the first week, but just avoid a lot of aggressive exercise where you may get sweat in the eyes because that can dry out and irritate the eyes, and we need the flap to heal appropriately.
Dr. Jones, when you came out of medical school, doing an internship, what made you decide to go into ophthalmology?
Yeah, that's a great question. So I had no idea that I wanted to do ophthalmology when I started medical
I
school.
wouldn't think so.
I had done as an undergraduate some genetics research, and we did some eye diseases that we were studying. So I had kind of some interest and some knowledge of the eye when I went into med school, but you don't learn a lot about ophthalmology at all in medical school, and
I
that's
would
why
think.
it's not a common specialty for people to go into. I did a rotation as a third year medical student in ophthalmology, and I loved it. I really, to be honest, I didn't like anything else in medicine other than ophthalmology because I liked surgery, but I didn't like the very long hours of surgery and a lot of call and things like that, and being at the hospital at 4 a.m. Ophthalmology
Yeah.
afforded me the ability to do surgery, to actually make a meaningful, impactful difference in people's lives that I can very obviously see, and really just live a happy life. I am so happy with this specialty. I can't imagine myself doing another specialty. So I'm very happy with my choice, needless to say.
I got to tell you, I am so impressed with Wang Vision and all the different areas that you cover. Let's give everybody the phone number and your website if you have that.
Yeah. Give me 1 second here.
And we're actually scrolling it right now. We've got 615
Perfect.
321
There it is.
8881.
Yes, that's our phone number there, and we have a website which is www.wangvisioninstitute.com, where we have a lot of information regarding all the variety of procedures we do. Obviously, LASIK is the most common thing that most people have heard of, but there are a variety of vision correction surgeries we do at Wang Vision that a lot of people haven't heard of that work exceptionally well, some cases even better than LASIK. So I encourage you,
Wow.
if you're thinking about getting out of glasses or contacts or interested in improving your vision, that you call our office and set up an appointment or visit our website to learn more. And we'd be happy to help you.
Well, Wang Vision's going to be doing another show next month, but I'm like shot off for the first show. A lot of people want to know about the smile, so we'll have to
Yeah,
talk about that.
yeah, absolutely. Um,
Dr. Jones, thank you so much. What a
yeah.
great job you did today. First time, and have a wonderful Christmas and a very happy and blessed New Year.
You as well. Thank you so much for having
Thank you,
me.
Dr. Jones. Great job.
Thank you.
That's Dr. Kyle Jones with Wang Vision Institute. We're going to take a short break and we'll be right back.
Thanks for tuning in today to the Ask the Expert show on W4CY Radio and Talk4 TV. Tune in next week and every week to hear more from our experts on personal injury, insurance, air condition repairs, estate planning, Medicare, and many other topics in the areas of legal, health, financial, and home improvement. See you next week.
All right, so I see that you're